Hi everyone, I'm Dr. Cindy Ross. Today, March 24th, is Lp(a) Awareness Day. The Family Heart Foundation established Lipoprotein(a) Awareness Day to raise awareness worldwide of elevated lipoprotein A, also known as Lp(a). This is something that I'm super passionate about. Ask any of my patients. I check everyone for this biomarker. My mother had this genetic trait, and following COVID in 2020, we found out that my husband, Jason Ross, has it also. So you're probably wondering, what is lipoprotein(a)? You'll often see lipoprotein(a) referred to as Lp(a), pronounced Lp(a). It is an important genetic factor that increases the risk for both heart disease and stroke. Much like your low-density lipoprotein, which is your LDL cholesterol, the bad cholesterol, Lp(a) carries cholesterol in the blood. So what does it mean to have high Lp(a)? The first thing to know is that the Lp(a) levels are genetically determined. You inherited your Lp(a) levels, and they are completely unrelated to diet and lifestyle choices. So even your fittest people can have Lp(a) and be at risk. You can find out your Lp(a) levels with a simple blood test. If your Lp(a) levels is greater than 18, you're positive for this genetic trait. If you have a high Lp(a), this is an independent risk factor for cardiovascular disease. High levels of Lp(a) collect in your arteries, gradually narrowing them and limiting the blood supply to your heart, brain, kidney, and legs. The amount of Lp(a) in your body is determined by the genes you received at birth from your parents. Lp(a) reaches its adult level by around the age of 5 years old, remains stable thereafter, except during acute illness, such as my husband with COVID, and menopause, which can both cause Lp(a) to increase. Lp(a) levels are completely unrelated to your lifestyle, so remember, it does not matter, it's genetic. Most of your general practitioners and your cardiologists, they do not run this biomarker because usually insurance does not cover it, and there aren't any medications on the market. They're still doing their trial runs. Lp(a) is so underrated. While most people know that low-density lipoprotein LDL or the bad cholesterol, it can cause heart disease, relatively very few people know about the potential risk posed by lipoprotein(a) or Lp(a). Yet, it is estimated that up to 20% of people worldwide have high levels of Lp(a). I see it every week, which this is associated with a person's risk of experiencing a heart attack or other serious cardiac events. Also referred to as Lp(a), this type of lipoprotein is comprised of an extra protein called apolipoprotein A, or ApoA. It's stickier than other types of LDL, so it may cause more likely to cause blockages and blood clots in your arteries. As a result, high levels of Lp(a) may mean that you are a higher risk for heart disease, stroke, or other serious conditions related to blockages in your arteries. The dangerous thing about Lp(a) is that it's constantly producing soft plaque. I always talk about it. It's like a little devil over here. It's producing soft plaque, and it's creating soft plaque that is unstable plaque, which puts you at a really, really dangerously high risk of a heart attack or stroke. Jason and I flew out to San Diego to visit with the #1 cardiologist, lipidologist in the U.S., Dr. Tsimikas, probably said that wrong, back in 2021, and I had already started Jason on a protocol to reduce his number. It all has to do with inflammation. So we began working on gut health, insulin resistance to reduce overall inflammation in his body. By the time that we got out to San Diego for his doctor's appointment 4 months after making, I was able to reduce Jason's Lp(a) from 270. Remember, anything over 18, he was at 270, got him down to 110. So your lifestyle is playing a huge part in regulating your risk for factors related to a heart attack or stroke. So some things that you can do: know your numbers, get your blood work done, start an anti-inflammatory diet, cut out processed and fried foods, reduce alcohol intake, start a supplement protocol supporting your deficiencies. I was actually at yoga a little while ago, and we were talking about this really young, fit guy. I think he was mid-50s, died of a massive heart attack, and it was because he had lipoprotein(a). So as of always, if you have any questions or if you're ready to get started, give me a call, 251-949-2220. Visit my website, lifewellnessforever.com, or reach out to me via email, cindy@drcindyross.com. Happy Friday. Have a good weekend.